the long run. Akash was sitting at his desk in the college hostel, puzzled by a maths problem. Now, his friends would give you the testimonial that he was a brilliant young boy with straight A's in all subjects. His parents had high hopes from him. He was very amiable and a college heartthrob. So while he was working, his friends burst into his room. Hey, they're serving hot samosas in the mess today. Jaldi chal. But he didn't feel like eating, so he refused. He looked at his watch. 7:58 a.m. Another 60 minutes before the class starts. Should I hit the gym today? I didn't sleep well last night. He thought for it. I wonder how I managed to go every day until the last month. While he was toiling through his maths book, he found out that he just could not find a solution and gave up. So he got dressed and went to his favorite lecture, chemistry. But today he was feeling extra sick. And just when he was about to slip into slumber, his teacher called out, "Yes, Akash, could you tell the answer?" Awoken, he looked at the board, read the question, and knew the answer immediately. He started confidently, but got confused in the middle. Was it copper or aluminium? He mumbled something vaguely and sat down. And while he was writing, his pen's ink ran out. Why? That evening, his friends found him standing on the ledge of the 10th floor roof, ready to jump off. They shouted, "Akash, Akash, what are you doing?" and hauled him back. A friendly young boy with excellent grades. What prompted him to take that step? After all, he showed no signs of sadness or anxiety, and he was performing well. Or did we all fail to miss? Akash's difficulty in focusing on his maths problem, not eating properly, avoiding his friends, skipping gym which used to be a happy ritual for him, insomnia, self-doubts while answering a question he knew the answer to, and being overly frustrated when his pen's ink ran out. My fellow Toastmasters, today I'm going to talk about an invisible illness called high functioning depression. Many people think it's not a depression at all. Clinically, it is not. According to American Psychiatrists Association, clinical depression is a mental health disorder characterized by severely depressed moods or loss of interest in activities, causing significant impairment in your daily life. Now, unlike a major depressive episode, high functioning depression or HFD would probably not interrupt your daily routine. Hence, high functioning. Psychologist Michael Silverman talks about this in one of his blogs. I've had patients say, "I feel so unhappy all the time. I cannot sleep properly. I wish I could stay under the covers all day. I feel inadequate. And I struggle to think clearly. And I cannot remember a time when I did not feel this way. Yet I get up every day, I go to office, I can give a presentation, negotiate and close deals. Hence, I must not really be depressed." Patients often self-diminish the seriousness of their own disorder. And this makes it even more difficult to identify because it does not fit the stigma surrounding the typical depression. Then how do you spot it? If you feel like you're trudging through mud every day, exhausted, find it difficult to focus, experience insomnia or oversleeping, or have a loud inner critic, then my friend, there's a good chance you're suffering from HFD. And just like a physical wound, you have to treat it. First step is to accept that you're wounded. Just because you can function while depressed doesn't mean you should not acknowledge it. Second step is to seek help. When we are injured and bleeding badly, we immediately rush to a doctor. Same way, treating high functioning depression requires the help of your loved ones, or maybe a doctor, who in this case is a psychiatrist. Third step, apply the band-aid on the wound. Let it heal. Plan social time. Engage in community events like volunteering or team sports, etc. Exercise and limit your screen time. Fourth and the most important, give it time. Be patient. It will get better. Now coming back to Akash. It turns out he always felt an internalized pressure to be perfect, to keep it all together, and to exceed those high expectations set from him. But now he's recovering slowly. He was lucky to be saved that day, and with the help of his loved ones, he's gaining back his confidence and positive outlook. Depression is not a one-size-fits-all illness. It manifests itself in various ways. So if you think that your loved one is showing signs of high-functioning depression, I urge you to support him or her by simply helping them maintain a good routine. Food, exercise, sleep. Just be a good listener and refrain from moral judgment. Now, it might not feel like it, but there is an upside to high-functioning depression. And if addressed appropriately, it can help you make a positive change in your life or address an underlying issue. So pay close attention to your mood and take out the time to explore what's affecting you. Because this matter need not be a secret or followed. Thank you.